pulmonary embolism, or PE, is a life-threatening condition that happens when a blood clot, usually from the legs or deep veins in the body, travels to the lungs and blocks blood flow. Most pulmonary embolisms come from deep vein thrombosis, DVT, where a clot forms in the deep veins of the legs. When this clot breaks loose and travels to the lungs, it can cause serious complications, including heart strain, lung damage, and even death if not treated quickly. The severity of a PE depends on the size and number of clots. A small clot might cause mild symptoms, while a large clot or multiple clots can block major lung arteries, making it difficult for oxygen to reach the body and putting extreme stress on the heart. The most common symptoms of PE include sudden shortness of breath, chest pain that worsens with deep breaths or movement, a fast or irregular heartbeat, coughing up blood, dizziness, and feeling lightheaded or faint. Some people may also experience swelling, redness, or pain in one leg, which could be a sign of DVT before the clot travels to the lungs. However, in some cases, PE can happen without warning, making it even more dangerous. Several factors can increase the risk of developing a pulmonary embolism. These include prolonged immobility, such as sitting for long flights, bed rest after surgery or illness, pregnancy, obesity, smoking, birth control pills, hormone replacement therapy, and medical conditions like cancer or clotting disorders. The risk is also higher in people with a history of blood clots or a family history of clotting disorders. Diagnosing PE involves medical imaging tests like CT scans, ventilation perfusion, V/Q scans, and ultrasound to check for blood clots. Blood tests, such as the D-dimer test, can also help detect clotting activity. Because PE is a medical emergency, treatment needs to start immediately. The main treatment is anticoagulant medication, or blood thinners, which prevent the clot from growing and reduce the risk of new clots. In severe cases, thrombolytic drugs, or clot-busting medications, may be used to quickly dissolve the clot. If medication isn't enough, or if the patient cannot take blood thinners, doctors may perform a procedure called a thrombectomy to physically remove the clot or place a filter in the inferior vena cava, IVC, to prevent clots from reaching the lungs. Preventing pulmonary embolism is crucial, especially for people at higher risk. Staying active, moving around during long trips, wearing compression stockings, drinking plenty of water, and avoiding smoking can all help reduce the chances of developing blood clots. For people who have had a DVT or PE before, long-term blood thinner use may be necessary to prevent recurrence. After surgery or prolonged bed rest, doctors often prescribe blood thinners or use devices to keep blood flowing and prevent clot formation. Pulmonary embolism is a serious condition that requires immediate attention, but with prompt treatment, many people recover fully. Recognizing the symptoms early and taking steps to prevent blood clots can be life-saving. If you ever experience sudden shortness of breath, chest pain, or signs of a DVT, seek medical help immediately.